After 60, magnesium deficiency is almost guaranteed.
Then why do Japanese seniors have half your heart disease rates without supplements?
That's exactly what I want to know. Because in the US, 68% of people over 60 are deficient.
And in Japan, our seniors get 480 milligrams daily from food alone. Seaweed, tofu, sesame, miso, it's built into our culture.
Meanwhile, I have patients with heart palpitations, muscle cramps, insomnia, all magnesium deficiency.
But you give them pills instead of teaching them about food.
Because American soil is depleted. Your vegetables have 60% less magnesium than 50 years ago.
That's a systemic problem. In Japan, we still practice soil enrichment. Our vegetables retain minerals better.
Hey everyone, Michael Harris here, cardiologist with 30 years of experience.
And I'm Hiroshi Saito, preventive medicine specialist trained in both Japan and the United States.
Today we're tackling magnesium, the most overlooked mineral for seniors.
We're going to show you what it does, what destroys it, and the dangerous combinations nobody talks about.
But first, I need to tell you about Margaret.
Who's Margaret?
67 years old. Came to my office with muscle cramps so severe she couldn't sleep.
What did her primary doctor say?
Told her it was normal aging. Prescribed muscle relaxants. Made it worse.
Let me guess. Magnesium deficiency?
Yes. But here's the problem. Her blood test showed normal magnesium levels.
Wait, how is that possible?
Because blood tests are useless. Only 1% of your body's magnesium is in your blood.
So the other 99% is where? In the bones?
Bones, muscles, cells. By the time blood levels drop, you're already critically deficient.
This is exactly why Western medicine misses so many cases. You wait for blood markers that appear too late.
Exactly. Margaret's body was stealing magnesium from her bones just to keep her heart beating.
And the cramps were the warning sign.
Her muscles screaming for help. When I started her on magnesium glycinate, 400 milligrams daily, 2 weeks, cramps gone.
Just 2 weeks? That's remarkable.
Her sleep improved. Energy came back. She told me she felt 20 years younger.
But then, something happened.
Yes. Margaret mentioned the magnesium to her daughter, who's a nurse. The daughter said, "Take calcium too."
Oh no. They compete for absorption.
Margaret started taking calcium carbonate with her magnesium. Within 3 days, all her symptoms came back.
Because calcium blocks magnesium at the receptor level?
Completely. They compete for the same receptors. Take them together, you're wasting both.
In Japanese medicine, we teach mineral timing. Morning for some, evening for others. Never everything at once.
And we're going to come back to Margaret's story at the end. Because what happened next changed everything.
But first, let's talk about what magnesium actually does in your body. Because 300 biochemical reactions is not an exaggeration.
Energy production, protein synthesis, muscle function, nerve transmission, blood pressure control, all require magnesium.
And after 60, why does deficiency accelerate?
3 reasons. First, absorption drops. Your intestines lose efficiency with age.
By how much?
At 70, you absorb 30% less magnesium than at 30. Same diet, less benefit.
That's why in Japan, we increase magnesium-rich foods as people age. Wakame seaweed in every meal. Natto for breakfast.
Second reason, medications. Diuretics, proton pump inhibitors, blood pressure drugs. They all drain magnesium.
Wait. Blood pressure medication causes magnesium loss?
Yes. Diuretics like hydrochlorothiazide flush magnesium through your kidneys.
And doctors don't warn patients about this? That seems negligent.
Rarely. I see it constantly. Patient on diuretics for years develops arrhythmia. Nobody checks magnesium.
What's the third reason for deficiency?
Stress. Your body burns through magnesium when you're stressed. And aging itself is a stress on the body.
So it's a perfect storm. Less absorption, more depletion, higher demand. The body is fighting itself.
Exactly. Now let's talk about the heart. This is where magnesium becomes life-saving.
Magnesium controls electrical rhythm, correct?
Every heartbeat requires magnesium to maintain normal conduction. Without it, you get arrhythmias.
Atrial fibrillation?
Yes, sudden cardiac arrest. Studies show low magnesium doubles your risk of death from heart disease.
Doubles. That's terrifying.
And here's what makes me angry. When someone comes to the ER with atrial fibrillation, we give them IV magnesium.
It works that quickly?
Within minutes, the rhythm stabilizes. But do we tell them to take magnesium at home? Almost never.
Why not?
Because there's no pharmaceutical company pushing it. Magnesium is cheap, generic, no profit.
But in Japan, we teach prevention. Food sources first, supplements when absolutely needed. Prevention over pills.
And that's why your cardiovascular disease rates are half of ours.
Tell me about bones. Magnesium affects bone density too, and most people only think about calcium.
Absolutely. 60% of your body's magnesium is stored in bone tissue.
More than calcium?
No, but it's just as important. Magnesium converts vitamin D into its active form. No magnesium, no vitamin D activation.
So people taking vitamin D supplements without magnesium are wasting their money completely?
The vitamin D just sits there, unusable.
And calcium deposition? How does magnesium regulate that?
Magnesium tells calcium where to go. Into bones, not arteries.
Wait. So low magnesium causes arterial calcification? The calcium ends up in the wrong place?
Exactly. This is the calcium paradox. People take calcium for bones, but without magnesium, it ends up in their arteries.
Creating heart disease while trying to prevent osteoporosis. The irony is tragic.
I see it all the time. 80-year-old woman taking calcium supplements for decades, arteries like concrete.
But her bones are still weak?
Because the calcium never made it to the bones. It's sitting in her blood vessels.
This is frightening. We need to talk about sleep next, because insomnia is epidemic after 60.
70% of my senior patients complain about sleep. And you know what most doctors do?
Sleeping pills. Ambien, Lunesta, benzodiazepines.
Creating dependency, cognitive decline, falls, fractures. It's a disaster.
And magnesium offers a safer alternative.
Magnesium activates your parasympathetic nervous system, the rest and digest mode. It literally tells your brain to calm down.
How long before patients notice improvement?
Most people notice improvement within 3 to 5 days. Take it 30 minutes before bed, you'll sleep deeper and wake less.
What form do you recommend for sleep?
Magnesium glycinate. It's bound to the amino acid glycine, which also promotes sleep. Double benefit.
And the dose for sleep?
300 to 400 milligrams before bed. Some people need more, up to 600.
Any side effects at those doses?
At high doses, loose stools. That's when you know you've exceeded your absorption capacity.
So the body has a natural feedback mechanism. Start low and increase gradually until you find your limit.
Exactly. Your body will tell you the right dose.
Now, muscle cramps. This is what brought Margaret to you originally.
Muscle cramps in seniors are almost always magnesium deficiency. Your muscles need magnesium to relax after contracting.
Like a Charlie horse in the middle of the night.
Exactly. Night cramps in the calves, thighs, feet. People wake up screaming.
And Western doctors prescribe quinine?
Which the FDA warns against. Serious side effects, limited benefit. Meanwhile, magnesium works in days with zero risk.
What about blood pressure? Does magnesium lower it?
Magnesium is nature's calcium channel blocker. It relaxes blood vessels, lowers blood pressure naturally.
By how much?
Studies show an average drop of 5 to 6 points systolic, 2 to 3 diastolic. Not huge, but significant.
And safer than medications with their side effects?
Much safer. No side effects at normal doses. Plus, it addresses the root cause instead of just masking symptoms.
Now let's talk about dangerous combinations. What should seniors never take with magnesium?
First, calcium. We already covered this. They block each other.
How far apart should they be taken?
Minimum 2 hours. Ideally, take calcium in the morning, magnesium at night.
What about bisphosphonates? Osteoporosis drugs like Fosamax.
Magnesium interferes with absorption. Separate by 4 hours.
4 hours? That's very specific.
Bisphosphonates are fragile. Take them first thing in the morning on an empty stomach. Magnesium at night.
What about antibiotics?
Quinolones and tetracyclines bind to magnesium, making both ineffective. Separate by at least 2 hours.
This is getting complicated. People need a schedule.
That's why you need to tell your doctor about every supplement you're taking.
What about thyroid medication, like levothyroxine?
Same issue. Take it first thing in the morning, alone. Magnesium at night. 4 hours minimum.
And diuretics? You mentioned they drain magnesium earlier.
If you're on diuretics, you absolutely need magnesium supplementation. But monitor your potassium too.
Why potassium specifically?
Magnesium and potassium work together. You can't replenish potassium without adequate magnesium. They're a team.
So if someone has low potassium, the first step is checking magnesium level.
Exactly. Often, fixing magnesium automatically corrects potassium.
Brilliant. Now, let's talk about food sources, because I believe food should always come first before supplements.
This is where you shine, Hiroshi. The Japanese diet is magnesium-rich by design.
Seaweed is number 1. Wakame, nori, kombu. Incredibly high in magnesium and other trace minerals.
How much magnesium in a typical serving?
1 tablespoon of dried wakame has about 50 milligrams. Easy to add to miso soup every morning.
But Americans don't eat seaweed. What are our best sources?
Dark leafy greens are your foundation. Spinach, Swiss chard, kale. Consistency matters more than quantity.
1 cup of cooked spinach has about 150 milligrams.
Pumpkin seeds are exceptional. 1 ounce gives you 170 milligrams, the highest food source.
Almonds, cashews, black beans, quinoa, even dark chocolate if it's 70% or higher.
So you can build a magnesium-rich diet without exotic ingredients. But can Americans actually get enough from food alone?
Theoretically, yes. Realistically, most seniors need supplements because of reduced absorption, medications, and stress.
Which brings us to supplementation. The form matters as much as the dose.
Men over 60 need 420 milligrams daily. Women need 320. Most Americans get only 250.
That 60% gap explains the epidemic deficiency we're seeing.
There are 7 different supplement forms: oxide, citrate, glycinate, threonate, malate, taurate, chloride. Each has different properties.
Start with the worst one. What should people avoid?
Magnesium oxide. Cheapest form, only 4% absorption. Plus it causes diarrhea, which is why it's in laxatives.
So 96% goes to waste. What's your first choice?
Magnesium glycinate. Highly absorbable, gentle on stomach. Promotes sleep because it's bound to glycine.
Double benefit for seniors with insomnia. What about citrate?
Good absorption, but can cause loose stools. I use it for patients needing help with both magnesium and constipation.
And magnesium threonate. I've heard it's special for the brain.
Only form proven to cross the blood-brain barrier effectively. Studies show it improves memory and cognitive function in seniors.
More expensive than glycinate, but worth it for cognitive decline?
Absolutely. I recommend glycinate at night for sleep, threonate in the morning for brain function. You can combine them.
What about magnesium malate for energy?
Excellent for chronic fatigue. Malate helps your cells produce ATP, the energy currency of the body.
And topical magnesium oils and sprays?
Magnesium chloride oil. Spray on sore muscles, absorbs through skin. Great for localized cramps, but for systemic benefits, you need oral.
Can you take too much? What are the safety limits?
Hard to overdose if kidneys are healthy. Your body excretes excess. Main risk is kidney disease stage 3 or higher.
What are the symptoms of excess?
Diarrhea first. That's your safety valve. Severe toxicity causes muscle weakness, low blood pressure, irregular heartbeat. But that's rare.
So the loose stool signal is protective. Start low, increase gradually until you find your threshold.
Exactly. Now let's return to Margaret. We left her story unfinished.
Her symptoms came back when she added calcium.
I told her to stop the calcium completely. Just magnesium glycinate, 400 milligrams at night.
And the results?
Within 1 week, cramps gone. Sleep improved even more. But the real surprise came 3 months later at her bone density scan.
What happened?
Her T-score improved. Just from magnesium. No calcium supplement at all.
Because magnesium was directing her dietary calcium to bones instead of arteries.
Exactly. She was getting plenty of calcium from food. She just needed magnesium to use it properly.
Food first, then intelligent supplementation. That's the principle.
Margaret is now 69. Still takes magnesium every night. No cramps, sleeps 7 hours. Energy like she's 10 years younger.
One mineral changed her quality of life completely.
Now let me give you a practical protocol. If you're over 60, here's exactly what to do.
Assessment first, correct?
Look for symptoms. Muscle cramps at night, insomnia, fatigue that won't go away, heart palpitations, anxiety. Multiple symptoms mean high probability of deficiency.
Then increase magnesium-rich food?
Add dark leafy greens daily. Handful of nuts, pumpkin seeds as snacks. Give it 2 weeks. But if you're on diuretics or PPIs, start supplementing immediately.
What dose to start?
Start with 200 milligrams glycinate before bed. After 1 week, increase to 300 if tolerated well.
Monitor for loose stools, and if they occur, back off by 50 milligrams.
That's your sweet spot. Also, ask your doctor for RBC magnesium test. Red blood cell magnesium measures what's inside your cells.
Much more accurate than standard serum magnesium?
Exponentially more accurate. Most insurance covers it. About $40 out of pocket if not.
Worth every penny for real information.
One warning. If you have chronic kidney disease, stage 3 or higher, talk to your doctor before taking magnesium supplements.
Because kidneys may not excrete excess properly.
Correct. For everyone else, magnesium supplementation is remarkably safe.
Let's talk bigger picture. Why does magnesium matter so much for longevity?
Because it affects every major system. Cardiovascular, musculoskeletal, nervous, endocrine, digestive. When magnesium is low, everything fails faster.
Like removing a foundational pillar. The whole structure becomes unstable.
Perfect analogy. And this is preventable. This is fixable. Yet 68% of American seniors are deficient.
In Japan, we emphasize prevention from childhood. But it's never too late. Even at 70 or 80, you can still benefit enormously.
Margaret is living proof. 67 when we started. Now 69 and thriving.
Michael, if you could give just one piece of advice to someone watching, what would it be?
Don't wait for symptoms to become severe. If you're over 60, assume you need more magnesium and take action now. Test, supplement, track how you feel.
And my advice? Supplements are tools, not magic. Combine magnesium with good sleep, regular movement, stress management, and whole foods.
Your body is incredibly resilient. Give it the magnesium it needs and watch what happens.
Your future self will thank you. Take care of yourself.
Thanks for watching. We'll see you next time.
Stay healthy. Stay strong.